Hi, this is Kaye Ebron, trainee from Ncma, Nurse Caregiver Management Alliance from 8 Bats Extension. Today, I want to present to you the qualities of a good caregiver. We have 10 qualities of a good caregiver. Number 1 is the patience. Patience is how to care or how to deal with your patient. Ang ibig sabihin nito ay dapat meron tayong pasensya, mahabang pasensya. Kasi karamihan sa mga patient natin ay may serious illness, hindi nila masabi kung ano yung nararamdaman nila. Tulad ng mga bata, dinadaan na lang nila sa iyak. Kaya kailangan natin ng mahabang pasensya para alamin kung ano yung mga nararamdaman nila. Ganon din sa mga matatanda. Karamihan sa kanila, hindi nila kayang sabihin kung anong nararamdaman nila. Kaya kailangan natin ng pasensya para alamin kung ano yung mga gusto nilang ipaarating sa atin. Number 2 is the cheery demeanor. Cheery demeanor is showing a good mood. Kailangan nating ipakita sa kanila na kahit na pagod tayo, kailangan pa rin nating ipakita sa kanila yung magandang pakikitungo. Kasi yun ang kailangan nila. Kasi kapag galit tayo, mas lalo silang magtatantrum. Kaya we need the cheery demeanor. Number 3 is the multitasking. Multitasking is to perform one or more tasks in one time. Ang ibig sabihin nito, hindi natin kailangan mag-focus sa isang bagay kung kailangan naman nating sabayan ng isang bagay. Kunwari, inaantay natin yung oras ng pagkain ng ating pasyente at pagkatapos tapos naman na nating i-prepare yung mga gagamitin sa kanya, habang inaantay natin yung oras ng pagkain niya, kailangan muna nating gawin yung mga ibang bagay tulad ng paglilinis or pag-aayos ng mga ibang gamit. Number 4, being able to think quickly. Being able to think quickly is making a decision quickly. Ang ibig sabihin nito, kailangan natin makapag-isip ng mas maagang decision sa isang bagay, lalong-lalo na kapag wala yung resident doctor nila or yung family nila at may nangyaring hindi maganda, kailangan natin makapag-isip agad-agad yung una nating gagawin para ma-solve yung problemang yon. Number 5 is punctuality. Punctuality is being on time. Ang ibig sabihin nito ay dapat mas maaga ka sa isang bagay na gusto mong gawin. Kunwari, kapag yung patient mo kailangan nilang bumisita sa isang doktor, kung ang oras ng usapan ay 8, kailangan before 8 ay nandun ka na para maiwasan mo ang kahit na anong trouble. Number 6, willing to learn. Willing to learn new experience and skills. Ang ibig sabihin nito ay hindi mo kailangan nakapokus lang sa kung ano yung palagi mong ginagawa. Kailangan mo ring matuto ng ibang paraan na gagawin para sa isang bagay para hindi ka masyadong mahirapan. Number 7, being a good listener. Listen carefully and attentive. Ang ibig sabihin nito, kailangan mo ding makinig sa mga payo ng doktor at dapat kailangan mong pinapakinggan ng maayos para maisagawa mo ng maayos yung explanation ng doktor para dun sa pasyente. Number 8, kindness and empathy. Knowing the feeling of your patient. Ang ibig sabihin nito ay kailangan mo din malaman kung ano yung nararamdaman ng patient. Kunwari, yung patient mo ay malungkot sa araw na ito, kailangan mo siyang i-cheer. Kailangan mong alamin kung yung araw-araw na nararamdaman niya. Kasi nakakatulong din sa isang pasyente yung pag-cheer mo sa kanya. Kailangan mong iparamdam sa kanya na nandyan ka parati sa kanya para suportahan siya or para bigyan siya ng saya araw-araw. 9. Willingness to go extra miles. Ang ibig sabihin nito ay unexpected duties to go out with the patient. Kunwari, yung araw na yun ay bigla ang pag-alis, kunwari kailangan nilang magbakasyon, kailangan ka nilang isama. Dapat naka-ready ka, ready yung isip mo, ready yung katawan mo para sa travel na yan. Para maasikaso mo at magawa mo ng maayos ang iyong trabaho. Dapat palagi kang naka-ready. Number 10, being able to take the responsibility. Ang ibig sabihin nito is acknowledge your fault. Kailangan mong tanggapin yung pagkakamali. Kapag nakagawa ka ng pagkakamali, kailangan mong tanggapin yon, kailangan mong sabihin sa employer mo o sa boss mo na nagawa ko to, nagkaroon ako ng pagkakamali at kailangan mo ring mag-promise na hindi gagawin sa next time, gagawin mo na rin ng maayos. Yun lang po at maraming salamat. Hi, this is Ebron, trainee from Ncma, Nurse Caregiver Management Alliance from 8 Batch Extension. Today, I want to demonstrate to you the NGT feeding. What is NGT? NGT is a tube through the nose, down to esophagus, and into the stomach. The purpose of this is giving medication, giving food, or for dehydration for the patient. But before that, I want to show you first the equipment we need. First, we need a clean towel, a water, the formula, and the syringe, and a clean gloves. But before you go to the procedure, you need to introduce first yourself and tell to the patient what are the things you need to do to her. Hi ma'am, this is Ebron. I'm your caregiver for today. What is your name, ma'am? Do you remember the year of your birthday, ma'am? Okay, ma'am. Today, ma'am, I will give you food. Then after giving your information and asking the information of the patient, you can now proceed to the procedure. First, you need to elevate the patient into 45 degrees so that the food will easily go into his stomach. Then after elevating the patient, put the white towel in her chest. Then, you need also to check the tube inside the mouth of the patient if it in the position. After checking it, if the tube is in the right position, you can now proceed and give her the food or any formula you will need to do. Then, first attach the syringe into the tube. But before attaching the syringe, remove the cover. But before remove the cover, you need to clamp it so that we can avoid any air go inside the tube. After clamp it and removing the cover, attach the syringe. After attaching the syringe, unclamp it. Then, check the residual content inside the stomach. By pulling, then after checking if the residual content is okay, then push back. Then after that, you may now flush the tube before giving the formula. The first flush is 20 ml. Then after that, after you finish flushing it, put now the formula. The formula is 30 to 60 ml. After putting the formula, you need to flush again for final flush for 30 ml. Then after flushing it, remove the syringe. But before you remove the syringe, remember, you need to clamp the tube. Then, after removing the syringe, put back the cover. After putting back the cover, then unclamp it. Then after that, put the tube in a right place or in a nice place. Then, let the patient in this position for 30 to 1 hour to avoid any aspiration. Then after that, document all the important procedure you do into the patient. Thank you and good day.
Hi, this is Ebron, trainee from Ncma, Nurse Caregiver Management Alliance from 8 Batch Extension. Today, I want to demonstrate to you the transferring of the patient from the bed into the wheelchair and from wheelchair into the bed. But before that, I want to show you first the equipment we need. We need the gait belt, we need hand sanitizer, and of course, we need the wheelchair. But always assess your patient, inform your patient the things you're gonna do, and give your information, then ask the information of the patient, then ask their feelings. Hi ma'am, this is Kaye Ebron. How are you today, ma'am? Do you feel anything, ma'am? Do you feel dizzy, ma'am? Okay, ma'am. What is your name, ma'am? What is your birthday, ma'am? Okay, ma'am. Today, I wanna help you. I'm gonna help you to sit into the wheelchair. First, you need to lock the wheelchair. After locking the wheelchair, put hand sanitizer into your hand. Then, ask the patient to move their knees up. Okay. Then, if the patient is in this position already, help them get up. Then, I will help the patient to get up. I will put my one hand at the back of the patient and get them back up slowly. Then ask the patient move slowly their foot down into the bed. If the patient is in this position already, put your feet at the front of the patient. The other one is the back. Always straight your back. Then put the gait belt around the waist of the patient to help you or support the patient from standing. But in this case, I will use my hand to help the patient or support the patient from standing position. I will put my hand around the waist of the patient. Then after that, ask the patient to put their hands around your shoulder. Then slowly get up. If the patient is in standing position already, ask the patient to make small moves into the wheelchair. Then, ask the patient to hold into the wheelchair, then sit them down. Then, if the patient is in a right position already, put the safety belt of the wheelchair, unlock the wheelchair, and move. The second thing I will show you is how to transfer the patient from wheelchair into the bed. First thing you need to do is lock the wheelchair. Remove the safety belt of the wheelchair. Then put your feet in front of the patient and the other one is at the back and straight your back. Then put your arms around the waist of the patient. Then ask the patient to put their hands around your shoulder. Then stand them up. After that, make a small move into the bed. Then let the patient sit. Then help them to lay down into the bed. If the patient is already in a good position, in a good condition, you can now document all the things you do, the information, the procedure, and the assessment you did to the patient. That's all, and thank you.
Hi, this is Kaye, Ebron, trainee from Ncma, Nurse Caregiver Management Alliance from 8 Batch Extension. Today, I want to demonstrate to you the standard in bathing a baby. But before we go to the procedure, here are the important we need to do. Always inform the parents. The right place of doing the things is in the kitchen, and the right time is 6 a.m. to 10 a.m. in the morning. Then of course, always close the door, always close the window, off the air conditioner, off the fan. Then of course, always check the body temperature of the baby. The right body temperature of the baby is 36.5 to 37.5 degrees Celsius. If higher than that, you can postpone the procedure. Always gather all the materials near you so that you can avoid to leave the baby alone while you are bathing. The materials we need to do things is the shampoo, the body wash, cotton balls, cotton buds, thermometer, diaper, changing clothes, 2 towels, and 2 towels for wetting and for drying, and 2 basin, and of course the disposal bin. Then after that, always check the temperature of the water you will use. The right water temperature of the water is 38 degrees Celsius. By checking it is using your elbow or your wrist hand by dipping into the water. Then after that, you can now proceed to the procedure. First thing we need to do is remove the clothes of the baby. After removing the clothes of the baby, you can now proceed the cleaning of the eye. By cleaning of the eye is using the cotton balls. First thing you need to do is soak the cotton balls into the water. Then clean the eye from inner canthus and into the outer canthus. Same with the other side. Then dispose and pat dry. Then the next one is the ear. Soak the cotton balls into the water. Then clean the outer part of the ear. Same with the other side. Then dispose. Then pat dry. And take a cotton buds to clean the nose of the baby. And the other side. Then dispose. Then take again a cotton balls, soak into the water, clean the upper and the lower part of the lips. And dispose. And the second one is clean the face of the baby using the towel with the mitten fold. Then after that, soak the towel into the water using the S or 3 technique from forehead into the cheek into the chin. Same with the other side, from forehead into the chin into the cheek. Then after that, pat dry. Then next one is the neck of the baby using again the towel with the mitten fold. Soak the towel into the water. Then from back of the ear, retract the folds of the neck. Then clean. Same with the other part. And the next one is wash the hair of the baby. But before you wash the hair of the baby, make sure have no irritation or redness into the scalp of the baby. If have no any irritation or redness, you can proceed to the washing of the baby by holding the football hold. Always do the position of the baby lower the head than the body. After that, wet the hair of the baby. Take a shampoo. Then massage the head of the body from frontal to occipital. Then after that, rinse. Then dry. Then after that, next one is the upper extremities. First thing you need to do is take the towel again with the mitten fold. Soak into the water. First is the chest, into the abdomen, the axilla, arm. Pay attention to interdigit of the fingers of the baby. Same with the other side. Then pat dry. Then after that, take using again the towel to clean the back of the baby. Soak. And after that, lather the back of the baby onto the buttocks. Then after that, dry. And the next one is removing the diaper of the baby. Dispose the diaper. Then clean the inguinal part of the diaper part of the baby. The first thing you need to do is soak the cotton balls into the water. Then clean the inguinal part of the baby. Dispose. Then the genital part of the baby into the anus. Dispose. Same with the other parts. Then using a soap, wash the lower extremities of the baby. Then wash. Pay attention to the skin folds and to the interdigits of the feet. Same with the other part. Then after that, pick up the baby and put in the bathtub to rinse. Then rinse the baby. After rinsing the baby, put the baby into the dry towel. Then after that, put the clothes of the baby. After putting the clothes of the baby, you can now put back into the crib, and if the parents is around, you can give into the parents. Then after that, remove all the things you use, put back the things in the proper place, and dispose all the things that you need to dispose. Then after that, record, or if necessary, record or documents all the procedure you do into the baby. That's all, and thank you.